وببركاتك وبطاعتك وطاعة أوليائك إن شاء الله أقدرنا. اللهم إنا نتوسل إليك بنبيك نبي الرحمة وأهل بيته الذين اخترتهم على علم على العالمين أن تذلل لنا صعوبتها وخشونتها، وإن شاء الله تزيل عنا كل هم وغم، وتجعل هذا البناء وسيلة لطاعتك ولعلاج المرضى والمؤمنين والمؤمنات ومحمد.
On May 23, 2017, the first phase of Imam al-Hujja Hospital began its operation after a lengthy decade of hard and painful work motivated by the ambition of serving the less fortunate of the society. Imam al-Hujja Hospital project was established by the DRF, known as the Development and Relief Foundation, under the premise of attaining a well-integrated regional healthcare system where patients receive comprehensive and compassionate medical care at a nominal and or affordable fees. A key philosophy will be the focus on human values that are congruent with the moral dignity of the patients and their status, regardless of their ethnic and religious affiliations. Imam al-Hujja Hospital, with its 145-bed multi-specialty hospital, focuses on heart diseases along with ophthalmology, gynecology, pediatrics, orthopedics that are currently being supported by the state of radiology and laboratory departments. However, due to financial constraints, manpower, as well as highly skilled personnel shortage in this geography, the Imam al-Hujja operations will be in constant gradual development. The first stage included the opening of the low-cost general outpatient clinic, in which urgent care is given to the patients without undergoing intervention or complex surgeries. In this clinic, free services are given to the general public 2 hours a day throughout the week. In addition, the Diagnostic Imaging Department has successfully started operating under the guidance of Professor Sarwat Hussain, who also fills the Chief Medical Officer position.
The running of the hospital is envisaged to be on international standard, and we have instituted credentials committee to evaluate and credential physicians before appointing to the hospital. And there is a quality enhancement, continuous quality improvement committee, training and development department, and participation of the staff in all these activities. Before the hospital started, we had several days of nothing but training and dry run for the services that we have opened. And your enthusiastic and support is needed for this hospital. Just quickly to say that our charges to the patients are significantly less than those of the private hospitals and other hospitals in Karbala, and certainly probably half or less than half of that of in the Baghdad area.
The third and fourth phases are highly dependent on the availability of the suitable budget to start commissioning. For example, the cardiac catheterization lab and its auxiliary as well as its ancillary services will cost around $2 million. In addition to furnishing each of the 5 operation rooms with the required equipment, supplies and consumables as well as reagents, each room requires $300,000 for it to be operational.
What attracts me about working for Imam al-Hujja Hospital and fuels my passion for it is rather its mission and vision. They had centralized the underserved, the less fortunate, and those who need the medical care but don't have the means as its focal point. They have become the center of its objectives, and because of that, it actually makes me excited to come to work every day and work very hard to ensure not only are we meeting those deadlines, those objectives, but truly making a difference in their lives.
We at the pharmacy here, we work as a team to provide the safe and the clinically effective treatment for the patients. Most of the patients here that we are looking to serve are of a very low income background, and most of them are very poor. And this is exactly what makes us have a very different perspective on life and on our profession.
I'm a radiography technologist in this hospital, Imam Al-Hujja Ajalallah Ta'ala Farajahu. We see many kinds of patients that need diagnostic imaging. Some of these patients are low-income people that need medical care at low prices.
Thus, community contributions and participations in funding this project is essential for its survival. Imam Al-Hujja Hospital has dedicated itself to the underserved and less fortunate of the society. To implement this ideology, the hospital has started with a 2-hour free clinic service every day, specifically targeting the low-income families. Many of the low-income groups, in order to receive proper medical care, they need to travel to long distances or abroad and spend hefty amount of money. But having Imam Al-Hujja Hospital available with a low budget service, these individuals can stay at home along with their families and at the same time receive top quality treatments that suits their needs.
The generous donors, the contributors who have shown their unwavering support to the project for the past 10 years, they have supported the hospital, the platform in which people get treated. But after May 23rd, whatever contribution they give will go directly to the well-being of the patients. They will end up saving lives. Because before May 23rd, it was only a project. The contributions, the donations were going either to the building, to the furniture, to the medical equipment. But from now on, they can sense the patients. They can see the patients. They can get their IDs and their information. And here comes the importance and the beauty of the holy verse where Allah subhanahu wa ta'ala says, وَمَنْ أَحْيَاهَا فَكَأَنَّمَا أَحْيَا النَّاسَ جَمِيعًا. If you save a single life, as you have saved the entire humanity. Now with your contribution, you will end up saving lives in this hospital. Thank you very much.